So today we're going to go over the Quadratus Lumborum muscle. This is in your lower back. A lot of the reason this gets tight, and a lot of people complain that their lower back's hurting, well, a lot of times it's because of this specific muscle. So, a lot of times if you're sitting leaning on one side or the other, or as clients will stand, they'll stand on one side or the other. Now, on Steve, this red one is the Quadratus Lumborum. So the origin point is going to be right here on the pelvic bone, and then it connects, and the insert's here on your floating rib, and then through your lumbar spine. So when it gets tight, it's going to pull all that. It'll pull this direction toward the origin, so it all goes that direction. So what will happen though is a lot of people will be coming, or clients will come in and they'll complain that the other side hurts. And then what happens is our therapist will actually need to work the other side because it's what's actually pulling. All right, and then so that's Steve's job today. I'm going to slide him over. Go on over there. I'll let him watch. All right, so this is a couple of stretches we're going to show on this. So first we'll do a standing one. So what's going to happen is if she's going to stretch her right QL, what she's going to do is take her left leg and go behind her other one. I'm testing her balance right now too. Now that's a good point though. Make sure to maybe hold a wall or something during this in case you fall, or to keep you from falling. So what she's going to do is grab my hand over here. So all right, we're going to go lean over, try to pull onto that muscle. Do you feel it? Okay, hold it there. So and y'all may see that would be stretching that muscle out. Next, you can sit here for me, facing me. All right. We're just going to make her do the splits. I'm just going to. So the same situation, you're going to try to open the legs as much as possible, and then you're going to arch your body over. So go ahead and let's show this. We'll do it this way. So make sure it's not over here. I mean, you can stretch it here actually as well, but it's more of an over, just like that. Did you feel that pulling a little bit? All right, and then, Lainey was an example of that too. Her left side was hurting more than her right side, and the right side's actually tighter. So how as a therapist I'll do it is, if you notice that the right hip's climbing up more, what I'll do is have you lay on your left side.
Like completely on the...
Yep. All right. Oh. All right, just stay there. Yes, I tell my clients, just stay. I'm going to bring her knees up. This is something all y'all can do. So as clients too, get your palms like this. Not you. I'm so bossy. It's like, what do I do? All right. You're going to grab their pelvic bone right here. You're going to grip and pull, and then they're going to pull against you. So pull away. There we go. And let go. Do a series of this, maybe about 3 or 4 times. The deeper the breath, the better. And again. Next, what I'll usually do is right on that pelvic bone again. I'll pull my forearm in there. And I'm pulling one way and pushing the other. All okay? And then you're going to walk your way down the pelvic bone. Angela is my videographer today. You can say hi, Angela.
Hi.
What I'm really doing is I'm teaching Angela all these techniques right now. So that's what this really was about. All right, because I have a massage with her next week. So,
I will be sure.
And this time I'm not canceling. All right. So this next one, you can grip their arm. Just don't rip their arm off or out of socket. Hold the pelvic bone, and good stretch. Do you feel the stretch? Good. All right, and then lay on your stomach for me. Now on this, usually, like I said, it's the right side. So we're going to bend this knee out and up. So there we go. And normally what I would do is get some lotion and kind of work on this area, to soften it up, push away from the spine. Do both sides. You can put some weight on their hip. Just kind of loosen that up. And then, if it was their right side, I would pull them across the table without them knowing so they get scared. Like, what's going on? And again, you get a good stretch in there, and you can even work this area as well. Lastly, one of the main concepts that people are lacking is they are getting the massages, which is helping their mobility a lot, but they're not strengthening those muscles to keep them and stabilize them where they need to be. So I'm going to have Lainey get onto all fours. Make sure you're good and covered there, please. Thank you. She knows where I'm talking about. All right. Now, if you want to do the advanced version of this, you would be in a push-up position. But what I'm going to have her do, keeping her back straight, I want you to bring this knee out and up towards me. So, okay. This is a very, what's the word? Exaggerated version of that. But she would basically want to come up like that and then back down. Do you feel that through here? You want to tense this part up. And then the other side, try that. Yeah, you should feel, she's probably a little too high. Like I said, she's just a good sport trying. It's a tough exercise definitely on a massage table. On the mat, on the ground, is a little easier. Go ahead and get up. I'm going to show y'all too. She's like, well, I didn't do good enough. No, you did great, Lainey. So, what it kind of looks like again, coming up like that. Tense it up. Try to lean into it as well. Breathe out on your way up and in. Engage those abs. Like I said, if you want to go into push-up position, you can do the same thing. I'm probably all red now. All right, well, let me know what y'all think. If you have these issues, come on and see us. We can work them out for you and teach you how to strengthen and get, loosen your muscles and make you feel better. Thanks again. Please comment below your thoughts, like our videos, and follow us on Instagram, on TikTok, and YouTube.